Good evening to both Kanagi and my fellow classmates. We are from Group 2, and before we start the presentation, let me introduce our team. We have Ken, Stella, Gun, Daniel, and me, Salina, in the team. And we are going to present about the challenges and opportunities encountered by Alpro Pharmacy. COVID-19 impacted almost all industry, including Alpro Pharmacy, which is from the community chain pharmacy industry. First, I will introduce the industry background of community pharmacy. According to Pharmacy Community in Malaysia 2020, the ratio of community pharmacy to Malaysia population is 1:12,757, and there are 2,554 community pharmacy in Malaysia. This number shows that there's still room for community pharmacy to grow more. In Malaysia, retail chain grew by merging with other smaller chains or independent pharmacy, for example, Healthline Pharmacy merged with Redaka Pharmacy, or 7-Eleven Group acquired Caring Pharmacy. Community pharmacy is shifting to a trend of digitalized pharmacy as stated in telemedicine blueprint by Ministry of Health, and COVID-19 pandemic has evoked the development of digital pharmacy. Now we will look into the background of Alpro Pharmacy. Alpro Pharmacy is Malaysia's best and largest precision pharmacy chain with the tagline of Big Dream with a humble start. And Alpro Pharmacy provides a wide range of services, include Medi-service like Medilist, Medipack, and Medicheck, home physio, rehab team for hospital bed oxygen core rental service, single care, Super 365 glucose monitoring, and also minor consult, which focus on affordable medicine for minor illness. The mission of Alpro Pharmacy is for a healthy and vibrant world. Alpro Pharmacy managed to open more than 20 outlets in 1 year and achieve revenue growth more than 200%. And currently, Alpro Pharmacy has more than 135 branches all over Malaysia and still expanding. In Alpro Pharmacy, CEO pharmacist Loh Siu Xiang believes that incorporating Kaizen from management to frontliner enhance the business environment and also improve the company as a whole. Alpro Pharmacy also awarded for Best E-Branding of Retail Pharmacy in 2021 and Malaysia Favorite Website Awards in 2020. Next, I will pass to Gan.
Thank you, Sasa. My name is Gan. During the first COVID-19, Alpro Pharmacy realized that many people were either delaying or avoiding seeking medical care for minor illnesses because they were either too worried about COVID-19 in clinics or having financial constraints. Therefore, Alpro Pharmacy launched the Minute Consult, providing an alternative option for the public to seek medical care for minor illnesses in their pharmacies for less than 20 ringgit. And to date, there are over 400,000 patients have benefited from this. Furthermore, Alpro Pharmacy also adopted new technologies and established online pharmacy, allowing patients to acquire medications without stepping out of their comfort house. All they need to do is upload the prescription, and even if they do not have that, the e-prescription and e-consultation services are available. The online pharmacy has also broken down the international border, where Alpro Pharmacy is delivering to neighboring countries like Singapore, Brunei, and even Indonesia. In addition, Alpro Pharmacy also came up with a revolutionary and personalized medical packaging service known as the QQ, and where all the medications are actually packaged into one single pouch, allowing patients to have them according to schedule. Since medication delivery received a surge of demand, and medication delivery is a very time-sensitive process where any delay will result in a huge serious problem. Therefore, Alpro Pharmacy actually collaborate with GDEX so that all medications are barcoded, allowing a real-time tracking and a secure delivery. In order to reduce the delivery timeline in Klang Valley, Alpro Pharmacy also collaborate with Foodpanda and Lalamove so that the delivery could be done within 2 hours. No doubt that the emergence of COVID-19 has tested the supply chain like never before. The pharmaceutical industry actually experienced shortage of generic drugs, oxygen tank, and even PPE in terms of the supply chain issue. Next, I will hand it over to Daniel to explain more on the challenges.
Thank you, Ren. Good evening, Prof. Good evening, fellow classmates, and also good evening to my team. My name is Daniel, and I will walk you through the challenges that was encountered by Alpro Pharmacy during the COVID-19 pandemic. We look into 6 aspects of the challenges from the technology, human resources, social, financial, legal, and then to the inventory. So from technology perspective, we look into the retailer or pharmacy and also the buyer/consumer. So from a pharmacy perspective, we look at the technology adoption of low to moderate disease because some of the items, like for instance, control medications, still requires the over-the-counter prescription before it can be dispensed to the public. And from a consumer perspective, due to the illiteracy of the scientific names of the medications, they still prefer to walk into an in-store pharmacy to get their medication supplies. Next, we look at the human resources. From a human resources perspective, we are looking at the frontliners that's actually serving in the pharmacy. This comprises the retailers and also the pharmacy workers. We have seen attrition rates going up because as most of the workers in this segment is affected by the COVID-19 disease. Those healthy workers will have to work prolonged hours to cover for their recuperating colleagues. And this has actually led to burnout of the workers and hence led to higher attritions during this period. From a social perspective, we have seen social media ordering purchasing methods. This can be seen in the event of KKM or the likes, recommending a product that is effective in combating the COVID-19 or curbing the COVID-19 spread. That results to an almost instantaneous effect of panic buying for that particular product next year. From a financial perspective, we are looking at the overhead of SOP compliance costs that was incurred by the pharmacists during this period. For instance, the implementation of the temperature screening, the PPE devices for the retailers and the pharmacies, hand sanitizers for the consumers, so forth. That has actually led to higher operating costs for the pharmacies during this period. And also there is the losses from the sudden increase of PPE prices. Like for instance, there was directives to lower down the PPE prices. So those stocks that was purchased at a higher price previously is sold on lower price to meet the regulation. From a legal perspective, there's challenges to dispense the chronic disease medications. This still requires prescription before they can be dispensed, and the longer lead time to obtain approval for surgical masks to be used for public by the MDA, Medical Device Authority. Lastly, we look into the inventory portion, which is also a challenge for Alpro because of its huge presence, about 100 plus branches across Malaysia. This has led to product dispersion and relocation challenges, for instance, to distribute the load of these supplies to the different outlets, those higher volume outlets, lower volume outlets. Also at the same time, Alpro is having challenges to source for new suppliers because the existing suppliers couldn't meet demand, so that looking for a new supplier. So in a nutshell, this is the challenges that is encountered by Alpro Pharmacy. Next, I'll pass to my teammate, Satala, which will walk you through all the innovations.
Thanks, Daniel. I'm Sitala, and in this slide, we will look at how Alpro Pharmacy have taken the COVID-19 as an opportunity to introduce a few innovations that benefited them tremendously. First, Alpro Pharmacy introduced the e-pharmacy system where customers can seek doctor's consultation and purchase prescribed medications online. Agile Buy is also launched. It is a quick and flexible way to buy hard-to-source medical products by consulting a team of professionals 24 hours. For example, if you need a customized chair for disabled, you can just consult them anytime from your mobile and the equipment will be delivered to your doorstep. An integrated e-commerce platform was also introduced. This is something like Shopee or Lazada where you can purchase any items physically available in the pharmacy or even the on-the-counter medications. In addition to this, the Silver Care program, which was already in place, was expanded further and a full range of services was launched. For patients with morbidities such as diabetic and in high-risk category of COVID, Alpro Pharmacy took a leap in introducing their smart glucose monitoring system. This is not something new in the market, but Alpro Pharmacy utilized the COVID situation in a more efficient way by introducing the combination of consulting services together with the technologies such as apps like Health to Sync that can be downloaded directly from your Play Store. Search for vitamins and supplements during pandemic resulted in an opportunity to Alpro Pharmacy in introducing their new online vitamin selling platform called VitaPack. This service allows the customers to consult, purchase, and get customized supplementary diets according to their needs, all done literally at the user's fingertip without having to leave their house. Thank you. Now, let's look at the sales perspective. It is clearly seen the whole Malaysia's pharmaceutical industry's online sale increase and is predicted to increase more by year 2024. Alpro Pharmacy's main strategies and focus on sustaining the business during COVID was on service or product differentiation for multiple levels of customers, and it is clearly seen fruitful for them when we look at their sales from 2019 to 2021. Thank you. Moving on to next slide.
Next, I'm going to talk about lesson learned and recommendation. The first lesson learned is the importance of stock monitoring. As we know, during the pandemic, a lot of the pharmacies, they face the problem of out of stock. So our recommendation is to have real-time monitoring on the stocks and designated stock distribution based on the local population. The second lesson learned is the lack of training for staff. During the early stage of pandemic, most of the staff, they do not have the skill and competency to handle the pressure and also SOPs from the government of Malaysia. So our recommendation is to have disaster management for the company and also motivation seminar for the related staff. The third lesson learned is the technology integration. During movement control order, the interaction between customer and pharmacy greatly reduced due to the limited working hour. Our recommendation is to have digitalized pharmacy and also collaboration with delivery platform such as the Foodpanda and GDEX. In conclusion, pharmaceutical industry is one of the industry that benefit and had boost in sales and revenue compared to the other industry. Alpro, as one of the key player in the industry, has worked well compared to the others competitor. There's 4 steps taken by Alpro that had made them more success compared to the others. The first one is adapt to customer behavior, where they provide the products that suit to the customer needs, such as the personal protective equipment like face mask, face shield, and also disinfection products. The second is by embracing and adapting new technologies, such as digitalized pharmacies, where most of the service are actually putting in their website. The third one is provide new services, such as agile buy, where the customers can call or live chat through their website to ask the opinion of the pharmacies. The second one is the Sugo 365, where there's a device for monitoring the glucose level in their customers. The fourth one is the partnering with strategic partners such as GDEX, which is their delivery partner, and Talk to Us, which is the online doctors. That's all from us. Thank you.